The first deaths from the coronavirus in the U.S. took place at the Life Care Center, a nursing home in Kirkland, Washington, in late February. So far, more than 20 people have died in the state, the great majority of them residents from the Kirkland facility. It has been a heart-wrenching time for Vanessa Phelps, whose 90-year-old mother is a resident of the Life Care Center. She hasn't been able to see her since the center went into lockdown.
So she's feeling claustrophobic, depressed, stressed. This past week, she's felt the stress of the staff and me not being able to visit her.
That's the kind of scenario health experts are worried about. As the number of cases continue to rise, experts are increasingly concerned about the spread of COVID-19 in eldercare facilities across the country.
It is a concern, and I think the experience out of Washington State has been enlightening, that this virus is deadly for the elderly and those with impaired immune systems. So in those type of facilities where there are clustered groups of elderly, they need to work really hard to keep the virus out of their facility.
The situation in Washington State is tragic. An outbreak in a long-term care facility is one of the things we have been worried about from day one.
Part of the concern is the general shortage of coronavirus test kits, so residents in eldercare facilities are being quarantined while they wait, which is causing anxiety and uncertainty for family members like Phelps.
If emergencies happen like this, you should be prepared. Separate the people that have it and don't have it. Test everybody. I've been tested twice in a 7-day period, yet my mom hasn't been tested once. Unacceptable.
Health experts say they are working on that and providing guidelines to facilities across the country should the virus strike.
If a resident becomes sick in a nursing home with what's called an influenza-like illness, which is fever, sometimes cough, shortness of breath, other signs like that, the staff know that person needs not only appropriate clinical evaluation and care, but also precautions to prevent the spread to other residents.
Staff and visitors are also being told to self-quarantine for 2 weeks if they think they've been exposed to the virus, something Vanessa Phelps is already doing.
I'm numb. It's been 7 days of hell, and I'm numb. I can't cry anymore. I've turned myself off. I have to, for self-preservation.
Julie Taboh, VOA News, Washington.